Good afternoon, everybody. My name is Amanda Watkins. I'm a certified nursing assistant, and I am a community health worker at Samaritan Healthcare. Before we get started, I do have to warn you, my face on the left side droops. I'm not having a stroke, just nerves. Got cut. So we have been invited here to talk about the barriers that Samaritan faces with behavioral health and how we navigate this. This is
Carolyn, Egts. I've been with Samaritan for about 5 years, and I'm also a community health worker and a medical assistant. Our objective today is to help you recognize barriers in obtaining behavioral health services that are difficult in a rural setting, and we're not unique in our struggles with other community organizations in this rural health setting. So we've had to be creative in how we get behavioral health and overcome the barriers to help our patients.
The ways that Samaritan identifies behavioral health needs is we listen to our patients when we're speaking with them. Sometimes they may not flat out say it, but they give small little indications, and the more that they talk with us and feel comfortable, the more they can feel like they can share. We also offer the PHQ-9 assessment at every visit that you have with a provider with Samaritan. If the score is high, then we pass that along to their actual PCP, and then they go and they connect with them and talk about, okay, why does this? You want to elaborate more about why it was high for this, and what can we do to help you? We can also do this during our medication reviews, and we can recognize patterns of the overuse of our emergency room, or if they have a pattern of making appointments and tend to canceling them or doing no-shows, or just the patient asks.
In a perfect world, the patient comes in and says, okay, I need behavioral health. I know I need talk therapy, I've had it before someplace else, this is what I want to have. Then the PCP places the referral, and then the insurance is verified, and intake documentation is completed by the patient in a timely manner, which is about 3 days before the visit. And then that appointment begins in a perfect world.
Unfortunately, in reality, the patient doesn't always know or understand if they need medical services, medication services, or therapy services. If there is an agreed upon need with the patient and their provider, then the referral is placed. However, it can go into a very large queue where it sits in place for quite some time. Currently, our medication specialists are scheduling for 2 months in advance. And unfortunately, our therapies, behavioral health therapy, it's looking at about a 5-month wait. Benefits may or may not always be verified within a timely manner. And the intake document that the patient has to fill out, it is 9 pages long, and it can take some time. Also, we unfortunately at this time cannot send it to our patients via MyChart. We, however, can give them the form in person, email it to their personal email, or mail it to them. That also is a risk. The patient may not ever see it in their email, or they may forget that they filled it out at home, or check their mail. I don't check my mail at home very often. The patients may not or may not even complete the documentation that they need prior to the appointment, leading to the provider needing to cancel that appointment, and then the patient needs to start this process all over again by rescheduling. And the provider may not speak the same language as the patient. Things get lost in translation, but we try our hardest. Not everything is translated perfectly.
times they get the document emailed to them and they have no printer to print out the intake form. So that's another barrier that they would have. But let's take a positive spin, and we do have 3 medication management providers and 2 mental health therapists and another 2 medication management providers coming at the end of the second quarter.
Some of the barriers that we tend to see often at Samaritan is the lack of the integrated behavioral health within our organization. It is not very, unfortunately, it's not very easy for us to say a provider diagnosed you with something. You may feel uneasy, anxious, scared. We can't just pull a behavioral health specialist into that appointment after giving you this news and have you talk to them. You have to get the weight. The referral needs to be placed in. The patient may not want to share their information with a provider who this is the first time I'm seeing you. I don't want to share everything with you. I'm not comfortable. Also, of course, the lack of understanding. Do I need medication services or do I need therapy? And a lot of patients don't know about all the resources that are within our organization. Oftentimes, when you think behavioral health, you think, I need to go to Yakima, I need to go to Wenatchee, or Tri-Cities. I can't get this service here in Breakout. And insurance. Insurance is a big thing. We run into a lot of insurance. Does my insurance cover it? How much does my insurance cover? It sucks, and they don't understand that.
Behavioral health coverage varies by insurance, and it goes into a very large field. And if they decide they need mental talk therapy and they get a referral for medication, they have to start the process all over again. So it's really difficult to understand that at the very beginning. The patient's cost will determine if they can be seen, if there's full coverage or if there's no coverage, if there's a deductible or copay or co-insurance. It's all variable to them because a lot of people are on limited income. And
Currently, though, how we have been tackling these issues is the integrated internally within Samaritan. We refer our patients who have providers with Samaritan to our behavioral health specialists, whether it's the medication or the therapy, which can make it a little easier and a little bit less of a wait time. Not very much, unfortunately, though. Our online resources can refer patients to. There are places that take insurance or are low cost. You can get this assistance online via telehealth, basically. And we utilize the local resources that we have around us, like Renew, all those other places. We encourage our patients to not just stick with Samaritan. Just because you're with Samaritan, we don't say, no, you can't go seek help other places.
they also have barriers to transportation. They lack the transportation, the vehicles aren't reliable, or they don't have the money to fix them. And public transportation doesn't pick up everyone where they're at, and that can be hard for them. Getting services that are not available locally, sometimes they have to go to Spokane, and we use another service called Special Mobilities. And Special Mobilities needs documentation from our providers saying the need for the patient to go out of town. And that can be challenging at times because our providers are busy, the patients are busy, and we have to coordinate everything with everybody, and then they have to approve it, and it has to be done within 2 weeks of their appointment, so that's really hard. And we've tried reaching out to nonprofit organizations in the area to help our patients get to different locations.
I recently had the pleasure of assisting a patient who was seeking a medical detox. Unfortunately, Moses Lake does not have a medical detox center here in Moses Lake. The patient expressed concerns because she didn't have finances to get there. She didn't have a car. She wasn't sure if her insurance would cover it. I coordinated with her insurance caseworker to confirm that her insurance was covered of it. We got the referral placed by her doctor, and then I coordinated with a local nonprofit organization here in Moses Lake that assisted with getting her to and from the facility, as well as we secured the bed for her.
Another barrier we have is language. The patient and the care team don't always speak the same language, or the scheduling is misunderstood. Multiple languages are spoken here: Russian, Ukrainian, Japanese, Chinese, French, ALS are all barriers that we have to deal with. But we do have resources.
For our language, we have an interpreter machine that we can bring inside the appointment to assist with that. We also have a language line that we call. We do offer some of our providers speak multiple different languages. So when a patient comes in and they speak a certain language, we try to connect them with that provider that speaks their same language to make it a little easier. And then we also make sure that we request that any document, any forms, what's that word? The after visit forms, summaries are printed out in a language that they can understand and read.
When seeking help, the patient understands that they will get recognized promptly within 2 months. The insurance is contacted, they find out what coverage they have, they find out if they can afford it, they schedule as soon as they can because the wait time is long. And if they need help filling out the intake document, I've helped some of our patients fill them out. They're 9 pages long and the space is really small. It's really hard for people to write a lot of detail, so there's also a challenge for that. We also ask that they be honest with the provider, and even though they haven't established care yet, it's best to have that honesty with them, and then we provide also some social support if they need some avenues of social support.
What to expect when you're seeking help? Now, this does not just apply with Samaritan. This is any facility that you go to, sadly. Is the lack of insurance coverage. Not every insurance provider provides the same coverage for all of our patients. There are some services that are available to some patients and others aren't. It depends on their plan that they have. The lack of local resources. I'm sure you guys are all aware. Grant County does not have a lot of resources when it comes to this. And that is a difficult thing when our patients are seeking help. But we work with their, we remember to work at their level also. We take it one step at a time. We don't try to rush our patients. We go at the pace that they need. We are there not to do everything for them, but to assist them with this process. So that way, if I'm not there, Carolyn's not there, we guided our patients. So that way, if it ever comes up again, they have the tools. They know what they need to do and the steps they need to take. And we ensure that they are ready to make the change. And if they're not, that's okay. We're there for them.
Our vision and mission and vision is all of us for each of you every time.
Together serving as a trusted regional healthcare provider.
Any questions? Comments?
transfer to a different provider?
No. So if they have a PCP with Samaritan, the referral process is just a little bit faster because they already see a provider with Samaritan. Outside providers, though, it takes a little bit more time to get the referral from them to our people and to schedule the appointment. It is a little easier. You don't have to go through all the unnecessary steps if you have a doctor at like community health center versus if you have a provider at Samaritan.
But if you do put in the wrong referral, say if you needed medication therapy, but you really need just talk therapy, there is another referral that needs to be placed.
And to be clear, if you want the medication or the talk therapy, you're not switching your providers. You still have your primary.
Right. I
So-
was wondering about like when they see the behavioral health specialist. So like if they
They
see
just
talk
need to,
therapy,
if they miss that appointment or if they come to the appointment and they don't have that intake form completely filled out, then that first appointment's canceled and they need to reschedule the first appointment. They still can stay with that provider that they referred to.
But it could take another 2 months or 5 months.
So I actually called Samaritan a couple of months ago and, for behavioral health, and they said that you actually have to switch primary care providers, and you can only seek mental health care with Samaritan if your primary care physician is a Samaritan employee. And the silos is what I'm finding very frustrating, collaboration amongst medical facilities, to be able to share resources. Because I've been struggling for months and months trying to seek care for a family member, who has private insurance, that it's good for mental health, it's got good coverage, but just finding somebody locally, that they can see. We're 6 months into this and still haven't seen somebody.
I'm gonna give you my contact information. I'm very sorry about that. That's not the case. I know this personally because I see a doctor at the community health center, and I had my daughter referred to somebody at Samaritan a couple years ago. So, and her primary is at community health center. So we just need that referral from that particular family member's provider in order to get in. But that is not true, and I'm sorry. Also, if you guys ever post anything on Facebook and Amanda Watkins comments, call me, I will help you. I promise. If I'm scrolling, it's not often that I scroll through Facebook though. But ask for Miss Watkins. There's like 6 Amandas. And that, is that our time?
15 minutes. We have 15 minutes.
We have 15 more minutes?
Dancing.
Okay, you guys have any more questions?
Yes.
How does your program work with like the emergency department, recovery coaches?
Well, when the fire department had their CARES thing, I was constantly in collaboration with Toto. Sadly, that program is no longer available, but Toto has reached out in the past and said, hey, I have this person. We do have somebody within the ACO, which is the department that we are working, that,
Accountable Care Organization.
yes, and that follow-ups with anybody that has been recently discharged. We try to call, make sure, hey, did you schedule an appointment with your PCP? Currently, also another struggle that we face is connecting with our care facilities. They don't like to answer sometimes, and if you're from here, answer my phone calls.
Skilled nursing.
Yes, skilled nursing facilities. I have in the past either gone to that facility or I turn off my caller ID on my cell phone and then I'll forget to turn it back on. So I wonder why my family doesn't answer my calls. And I find ways around it. If there's something that a patient needs and I don't know about it, my boss refers to me as a pit bull when it comes to finding resources. I did have a patient suffering from anxiety once because she needed to apply for Medicaid and all the words that the SHS was throwing at her, all these different informations and stuff, it just made her panic. So I assisted her. I went with her to DSHS. I noticed that she also had a hard time seeing those small little printed words. So I advocated and made sure that anything and everything that they give her was in large font. I confirmed with her that she could see it without having to put it like right in her face. And after that helped her. She was relieved and could understand and read exactly what was going on, because she'd be like, okay, there was a lot of information thrown at me. What did they say again? Oh, I have the forms. I can reread it now, thankfully. So, and then with local resources, I had actually the baseball team from here, Big Ben, assist a patient who was suffering from depression. He had multiple different boxes all over his room. He barely moved, couldn't do anything in his living room. And the clutter was just getting him worse. So I had the baseball team come in, and they removed those boxes. I will reach out to you. I will bug you. If I hear that you can help in some way, trust me, you're gonna hear from me a lot. So I apologize in advance, but if I can, I want to, and I will help, even if that means I need to pick you up and take you to my patient's house. So, any more questions? Because apparently we still have like 2 minutes. We talked too fast, I guess. When we practiced this, we had 17 minutes. We went over by, no, we went over by like 18. Oh, yeah.
So with all of the barriers that exist, is there like a subcommittee that's working on helping some of those, or do you do it on a case-by-case basis? I know the Herald publishes a resource guide, are all the avenues for, to access mental health services, that's in there, kind of a how-to guide to access care.
I haven't seen the recent one that I know that they were gonna publish personally. Have you seen it yet?
No, our website has all of our providers on there.
Yeah, I know that personally with every patient, it's not just with the behavioral health, it's case by case. I figure out. I just assisted a lady with also, she was facing foreclosure, and I helped her with that. I guess it is a wonderful thing that I've had such difficulties in life, because I know all kinds of things now, and I can help my patients. And I can get you help with cancer, I can get you help with divorce, child support, IEPs, college, lots of things. If I don't know it, I love to learn. But when it comes to just Samaritan and that, I'm pretty sure the board, we don't have an actual board or committee. And that was, I'm pretty sure, the main reason why we're here all today, is to try to figure this out, and so that we can create something. And I'd love to be a part of it. Oh my God, really?